Hey guys, welcome into this Y'all Politics broadcast. I'm Frank Corder, the managing editor at Y'all Politics, and joining me today is Dr. Amber Colville. And Dr. Colville, how you doing today?
I'm great. How are you?
Doing great. Thanks for joining us. You've had a fun, busy few weeks, and I want to get to that in just a second. But before we do, tell our viewers about you, where you practice, what kind of medicine you practice.
Okay. Well, I am originally from Jackson County. I moved back here in 2004 after my medical training, which I did in New York City. I have been in private practice in Ocean Springs in internal medicine since 2004. Currently living in Pascagoula, working here full time.
Well, you've experienced something last week that few do, especially from Mississippi. If you want to be honest about it, you were a doctor that you got pulled into a White House executive order signing, and you were standing right behind the president as he signed those executive orders that basically was aimed at lowering the price of prescription drugs. So tell us about how you got involved in that.
Okay, so that was very exciting. Obviously, I got the call Wednesday around 5:30, and needless to say, by 6 o'clock, I had a flight and a hotel booked. You get invited to the White House, you don't say no, right?
You
No matter
go.
what
That's
the
right.
reason is. So I became involved with a group of doctors from across the nation in 2017 when I attended the National Physicians Council. At the time, was done with a representative from Texas, and it was doctors that came together from across the nation to discuss different issues in medicine. Um, One of the things that I heard being spoken about when I was there was something called pharmacy benefit managers. This was the first time I had ever heard this in my life. Now, I had been in practice since 2004, and
Right.
year after year, it became more and more difficult to get things approved, to get medications approved, but I never actually understood why this was so difficult. When I went to this meeting and heard about these pharmacy benefit managers, what I learned was, and it's a very complicated topic and it makes a lot of money, so it's very hard to peel it away.
Sure.
The pharmacy benefit managers are the companies between insurance companies and manufacturers, and they are the ones who negotiate contracts. And that's how you have a formulary of things your insurance covers. And this is how this formulary is created. Well, in 1987, Congress passed a law called the Safe Harbor Act that at that time was only for group pricing organizations, which is essentially kind of the same thing, but instead of negotiating contracts for drugs, they negotiate contracts for pricing for drugs and equipment and gauze and band-aids and things like that for hospitals. Now that was all greatly intended when it first started in the early 1900s. Five hospitals in New York City banded together to buy in bulk to save money. But fast forward to the 21st century, and now what they are is just a money making scheme. They're a
Sure.
middleman between hospitals and what the supplies that they need. So this law was passed in 1987, and in 2003 it was extended to cover pharmacy benefit managers as well. And what that law allowed was for the GPOs and the PBMs to collect fees for these contract negotiations, which means that the insurance company is paying them to negotiate the contract. The pharmacy or the manufacturer is paying them to carry their product on the formulary. Well, in every other business, this is called racketeering. But in medicine, it has been made legal by Congress. So the only thing harder to get done than an act of Congress is to reverse an act of Congress.
Exactly.
This is what we've been trying to do over the past several years. So how does this bring us to these executive orders? Well, if you remember back in the early 2000s when the Part D part of Medicare was started by George
Sure.
W. Bush. That was also passed by Congress to add a pharmacy benefit for Medicare patients. Um, this executive order is to get rid of the PBMs with Medicare because that is what the federal government controls. Will this actually decrease drug pricing? I hope so. But at least for the first time, a politician has called these rebates that are supposed to go to patients, which in the Medicare population the patients never get.
Right.
They have actually called it what it was, which is a kickback. It is a legalized kickback. That's what it is.
So if this works out, if it plays out as the orders intend, what kind of savings are we looking at for these drugs?
Well, you have to think about what these pharmacy benefit managers collect. If they're collecting fees from everybody, but they're not producing anything,
Right.
and if you're a tiny generic drug manufacturer and the PBM says you have to pay them X number of dollars to carry their drugs, and they don't have that money, then that manufacturer goes out of business. Well, manufacturer after manufacturer after manufacturer all goes out of business. That stifles production, right? And
Sure.
if there's no production, prices go up, right? And the PBMs collect $30 billion a year.
Wow.
So at the end of the day, there's just not enough money for everybody, right? So the pie is the pie. So if they're getting $30 billion, then where is that coming from? Well, it's coming out of your pocket. That's where it's
Right.
coming from. So if you can get rid of the middlemen, then you've just added $30 billion to the pool. And if you can allow the more factories into the pool, then that creates more supply and your prices go down. I mean, I'm
So
not an
one of
economist, but I understand the general concept of
right.
supply and demand.
So one of the orders that was signed dealt with the safe and legal importation of drugs from Canada and other countries, where the price for identical drugs is lower. Why is that important?
Well, that is important because most of our drugs that we get in the United States are made somewhere else. And if they are made here, they are exported somewhere else and then re imported, which of course all adds money to that.
Sure.
And there is a very complicated way that there's international drug pricing, which I don't exactly know the nuts and bolts of.
Hmm.
But if you can get rid of all of the added on cost from importing those, then once again, it's all those middle men costs that get taken
Right.
out of the formula.
And one of the drugs, or two of the drugs that were, I guess, key to some of this was insulin and epinephrine, which, in Mississippi, that's a big deal, especially given our obesity rate. Is that correct?
That is absolutely correct. There was also an act done by CMS, the Center for Medicare, earlier this year that decreased insulin prices because insulin has been around forever, right? And there's a few of them, but for the most part, they've been around forever. And they are so expensive that people have to decide whether they're either going to eat or buy their medicine, but they can't do both. So
Right.
they either underdose their medication or they just don't take it at all. They don't buy it. And I'm constantly being called, can you change my insulin to some other insulin? And I can do that. But the result has been the same. They're all the same price, no
Right.
matter how many years they've been out. The price doesn't go down when they went generic. And for all these same reasons, these middlemen get all this money off the top.
So let's move back to the fun part of all this. And while that's important and while that's pretty, that's heavy lifting stuff that you're doing, the cool part of that would be that you just got to go to the White House and be a part of something that was, I guess, historic in some veins. How was that experience for you?
It was fantastic. I mean, first of all, flying during a pandemic was pretty good because there's nobody in the airports. Not that I'm saying the pandemic is good, but
Right,
nobody's sitting by you on the plane. You get to DC. It's not really busy. Everything's easy to get to. Of course, you have to wear a mask everywhere you go. We didn't wear masks when we were at the White House because we were tested before we went in there. We've undergone a lot of scrutiny because of that.
right, sure.
But we were tested before they don't just let people walk off the street into the White House and be 2 feet from the president,
Right,
a pandemic. Um, but we were escorted in. We had to clear security like normal, every
right.
background checks before we went in. And then we were told exactly what to do. We were sat in reserved seating and told when he went to the table that we would get up and stand there. And it was surreal, really. I'm still kind of pinching myself that I got to do that.
Well, I think that's pretty neat for a coach doctor to be able to be called up to the White House to stand behind the president for such a thing. That's one of those milestones that you'll be able to tell your kids and grandkids and great grandkids.
It will definitely be hard to top.
Just one more thing. As far as this COVID-19 pandemic continues, What is your advice? What are you seeing out there that Mississippians should be paying a particular caution to during these times?
Okay, so yesterday we had our highest numbers ever, right? We had over 1,700 new cases yesterday. Um, this this virus is real, and it is very contagious, and it can be very detrimental to some and very mild in others. I keep telling people it would be nice if we knew who was going to get really sick, and then we could just isolate those people. But
Sure.
we unfortunately do not have a crystal ball, so we cannot do that. So we have to take precautions: washing hands, don't touch your face, wear your mask in public spaces. And there's a lot of misconception about why we do this masking situation. The mask contain secretions that come out of your mouth and your nose. Large droplet secretions are what are contaminated with COVID-19 and everything else: staph, strep, influenza, coronaviruses, adenoviruses, rhinoviruses, all the other viruses that cause
Right.
common cold symptoms as well. If everybody contains their secretions, there is less transmission of disease across the board, not just COVID-19, but all of these viruses. If everybody contains their secretions, we lower the total number of virus cases that we have. That is the point of it. Yes, if somebody coughs in your face and they have COVID-19, a regular mask that's not N95 is not protective. But if everybody contains their secretions, there's an overall decrease in the disease. That is the point of it. I mean, I know everybody, like I said, when we were at the White House and we didn't wear masks, everybody jumped on us. The anti Trumpers jumped on us, the anti maskers jumped on us. Everybody wanted to take that picture and use it for their own political gain.
Right.
So it just decreases disease, period. Um, our numbers are high. So if we don't get these down, we are going to be in big trouble here. Luckily, the death rate is very low. We
Right.
don't exactly know what that number is, but I've probably had 20 or 25 cases in my own practice. One of those people was seriously ill. The rest of them were mildly ill.
Yeah. Well,
So
thank you for
that's the
that
good news.
perspective. Yeah, and we appreciate your time greatly today. It's a great story to tell of your experience, and also the fact that things are getting done that sometimes fly under the radar. And so I appreciate your willingness to come on and share your story with us today.
I appreciate being here.
That's Dr. Amber Colville. We thank her for her time today here on Y'all Politics. And as always, tune in to y'allpolitics.com on our website or across our social media channels for more Mississippi focused news and analysis. We'll see you next time.